Have you ever had a headache that would not quit and then suddenly realized one tooth felt weird too? Maybe it hurt when you drank something cold. Maybe chewing felt off, or maybe there was a dull ache you kept ignoring. Here's the big question. Can cavities cause headaches? Yes, they can, but usually not in the way people expect. A tiny early cavity may not cause any symptoms at all. The bigger problem starts when decay gets deeper, the tooth becomes sensitive or painful, and your body starts reacting to that pain. That is when people often focus on the headache and miss the real source. In this video, we are going to break down what cavities are, why pain from one tooth can seem much bigger than one tooth, who is most likely to miss the signs when it becomes urgent, and how to stop the problem before it gets worse. Stay until the end because one common mistake can turn a manageable cavity into a much bigger dental issue. So, what exactly is a cavity, and why does this question matter so much? A cavity is a damaged area in the hard surface of a tooth caused by tooth decay. In the beginning, you may not notice it at all. But as decay gets larger, it can lead to toothache, tooth sensitivity, visible holes or pits, discoloration, and pain when you bite down. That is the point where the problem stops being just a tiny spot and starts affecting daily life. The reason this matters is simple. Many people do not connect mouth pain with head pain right away. They assume the headache came first and the tooth is unrelated. But if the cavity is getting deeper, the pain can become more intense, more constant, and much harder to ignore. So the real answer to can cavities cause headaches is this: not every cavity will, but a cavity that is progressing absolutely can set off a chain of pain that feels much bigger than one tooth. Now let's answer the why. A cavity does not usually cause a headache just because it exists. The trouble starts when decay moves deeper into the tooth and the pain becomes stronger, sharper, or more constant. That deeper irritation can make the whole area feel inflamed and sensitive, especially when you eat something sweet, very hot, or very cold. If the problem keeps progressing, an untreated cavity can also lead to infection or a dental abscess. And that is where things can feel much worse. An abscess can cause intense throbbing tooth pain, a bad taste in the mouth, fever, facial swelling, and pain that spreads beyond the tooth into the jaw, ear, or nearby parts of the face. When pain starts spreading like that, many people describe it as a headache, even though the source began in the tooth. So yes, cavities can cause headaches, but most often when the decay is deep, painful, or infected, not when it is tiny and silent. So how can you tell if your headache might be coming from a cavity and not something else? Start with the pattern. Does one tooth hurt when you bite down? Do hot, cold, or sweet foods trigger pain? Can you see a dark spot, a small hole, or staining on the tooth? Does the discomfort sit on one side of the mouth and seem to build into the cheek, jaw, or side of the head? Those clues matter. Also pay attention to what happens over time. If the pain lasts more than a day or two, keeps coming back, or is strong enough that painkillers are not really helping, that is not something to keep guessing about. And if you also notice a bad taste in your mouth, red gums, swelling, or a fever, the concern goes up because infection becomes more likely. One important reminder: not every headache with tooth sensitivity is caused by a cavity. Sinus problems, grinding, cracks, gum disease, and other dental issues can also mimic tooth pain. That is why the pattern matters more than one symptom alone. If you think a cavity may be behind your headache, do not just keep chasing the head pain and ignoring the tooth. The smarter move is to calm the symptoms while arranging dental care. You can rinse your mouth with warm water, floss gently to remove trapped food if that seems to be part of the irritation, and consider over-the-counter pain relief if it is safe for you and you use it exactly as directed. Soft foods can help, and it is wise to avoid very sweet, very hot, or very cold foods if they trigger pain. Try not to chew on the sore side. And one big warning: do not place aspirin or another painkiller directly on the gums. That can burn the tissue and make things worse. Most importantly, remember that a cavity does not fix itself. If the decay is already causing pain, sensitivity, or a headache-like spread of discomfort, the real solution is finding and treating the tooth problem, not just masking it for another day. Now let's talk about when this stops being annoying and becomes urgent. If your cavity-related pain comes with facial swelling, a swollen jaw, fever, a bad taste in your mouth, trouble chewing, or difficulty opening your mouth, you need urgent dental attention. If swelling spreads toward the eye or neck, or if you have trouble breathing, swallowing, or speaking, that is emergency-level care. A dental abscess will not go away on its own, and waiting too long can allow the infection to spread. This is the part many people underestimate. They think it's just a cavity, when in reality the cavity may have already progressed into something much more serious. Severe toothache that lasts, pain that does not settle with pain relief, or swelling with fever should never be treated like a minor inconvenience. So if your headache seems to come with these warning signs, do not delay. The faster the source is treated, the better the chance of protecting the tooth and avoiding bigger complications. So, can cavities cause headaches? Yes, especially when the cavity gets deeper, becomes painful, or turns into an infection. But the real takeaway is this: not every cavity hurts at first, and not every headache starts in the head. Sometimes the clue is in a sensitive tooth, a sharp pain when you eat something cold, a dark spot you have been ignoring, or a toothache that keeps pushing pain into one side of your face. The earlier you catch it, the easier it usually is to treat. Regular dental checkups, brushing twice a day with fluoride toothpaste, cleaning between your teeth, and cutting back on sugary foods and drinks all help reduce the risk of cavities and the bigger problems they can cause later. And before we wrap up, a quick disclaimer: this video is for educational purposes only and is not a substitute for a personal diagnosis, dental exam, or medical treatment. If your symptoms are severe, worsening, or unusual, please seek professional care. If you found this helpful, subscribe and leave a comment with your experience, questions, or suggestions for the next video.